Hey everybody, what's going on? It's your boy Mike. So, I just finished work. Again, as I think I told you guys before, full time I work as a health and wellness coach manager, and part time I work as a physical therapy assistant. Um, just finished my physical therapy job. I work in the hospital setting, and what makes physical therapy in a hospital different from outpatient is how sick the patients are. And I typically work in cardio and vascular. Sometimes I'll have orthopedic patients, sometimes, but not very often. Um, Sometimes I just have patients with like ultra mental status, so their cognition's off a little bit. And sometimes I work in ICU. So again, I typically work in ICU, cardiovascular, sometimes transplants. What we call comprehensive units. I work in like a little bit of everything. I cover a lot of things. If you guys are curious about physical therapy, I work 10-hour shifts. So technically 10 and a half hour shifts because you have a half-hour lunch. I work a 10-hour shift. I start at 8 o'clock. I finish at 6:30. Today ran over a little bit, so I actually got off a little bit late. But you never know what you're going to walk into. Sometimes your day can be like everything's good. Your patients are all walking by themselves. You just have to make sure you just have to monitor them a little bit. Sometimes you have patients where they can't do anything. Now, how we measure a patient's strength is we have different levels. So we have what we'll call like independent. So you can do things by yourself. You don't need any help at all. Sometimes patients are supervision. They just need just watch them, just be careful. Standby assist, which is a little bit closer than supervision. It's like supervision, I can watch you from like 10 feet away, you're good. Standby assist, I'm probably closer to like 3 feet away. Contact guard is like, hey, I'm actually holding you just to make sure that you're good. I'm not helping you a whole lot. I'm just holding your arm a little bit, just to make sure you're good. Minimal assist, the way that we'd like to divide this aspect up is minimal assist, I'm doing like 25% or less of the work for the patient. We have what we call mod assist, which I'm doing about 50% of the work for the patient. Maximal assist, I'm doing like 75, I would say about 80%, maybe 90% of the work. So patient needs a lot of help. We have total assist, which is like you're doing legit everything for the patient. It's like it can be rough. Sometimes the patient can walk in. I've literally seen patients like walk in the hospital, and then just because of how fast things can progress, they end up being mod assist in 2 days, just because of the different factors they have going on. We call them comorbidities. And again, the more comorbidities that you have, which means the sicker you are, which means things can progress or regress, I should say, a little bit faster, which is not a good thing. Today was a pretty chill day. I usually have like 10 patients, which is not too bad, which is about regular for us for a 10-hour shift. And again, depending on how free the patient is, sometimes you can be in a patient's room for 8 minutes. Sometimes you can be in a patient's room for 2 hours. You never know. Just depends on how critical the patient is, on how much assistance they need, about if you're answering questions, things like that. There's people interrupting. You never know what you're going to get when you walk in a hospital, which I like about the hospital, because it's always different. You can be on the same unit each time and work with the same patient, but something can be different. Whether the patient is walking more, whether they're walking less, whether their oxygen levels go down, whether their blood pressure goes down, whether their blood pressure goes up. If this family that comes in from out of town, they have a bunch of questions. You never know what you're going to walk into in the hospital. The reason why I chose to stay in the hospital compared to going to outpatient, which you hear a lot of people like, oh yeah, I'm going to go to outpatient, I want to work with athletes and this and that. Just because you work in an outpatient doesn't mean you can work with athletes. I hate to break it to you. I'm the bearer of bad news, but just because you work in an outpatient doesn't mean you work with athletes. If you do, that's awesome, but you never know. I've worked with athletes in the hospital. You never know what you're going to get. I've worked with people who are in their teens. Like, I've worked with teenagers. I had someone who was like 96 today. I've had patients who are over 100 years old. I've had people who were in their 30s who couldn't do anything. I've had patients who've had both their lungs transplanted and they're walking 1,000 feet. You never know what you're gonna get. With the hospital, I like how critically you have to think. How sometimes you have to change your plan of care like on the spot. It's like, okay, like our goal is to do this, and this. You walk in, a patient's like their eyes rolling back or their eyes are gray. It's like, hey, what's going on? Wake up, and they're just not responding. It's like, we gotta call the nurse, we gotta call this person, that person. Or sometimes, you're reading the patient's chart, and the other patient's gonna be hard. It was maximum assist times 2 to stand them up. So again, it took 2 people, to stand with 70 to 80% doing the work for the patient. And it's like, man, this patient's gonna be hard. And you walk in, the patient's sitting on the edge of the bed, talking, laughing, joking around. It's like, hey, I'm here to help you stand up, and they jump up. You never know what you're gonna get in the hospital. Sometimes it's like their lab values will say one thing and they present as something completely different. And that's the important thing about talking to your patient, understanding your patient, listening to your patient, and also understanding what the lab values are. And also making sure that the patient can listen to their body. Because the lab values will say one thing and the patient will say, oh, I'm feeling this, and this. Or the lab values will say, hey, I'm feeling 100% fine. And you go into the patient's room and their eyes roll back in their head because you don't know. Or there are times where you're walking with the patient, and that's the important thing about communicating with your patients, is that you can be walking with your patient and you're talking and everything like that, and you ask them a question and they go silent. And it's like, hey, you okay? And you look at them and their face goes white. So it's like, we need to sit down, we need to call the nurse, we need to call respiratory therapy, we need to call a doctor, we need to call this person, that person. Another thing I like about, particularly where I work, because I've worked with a lot of coronary, we call CABG patients, so coronary artery bypass patients, so heart procedures. And there are so many things that you're not allowed to do with a bypass that sometimes patients think that they can't do anything. They're like, oh, I can't do anything, I can't do this, and I find it so fun that I can say, hey, you can't do this, or this, but what can you do? Or they're like, oh, I can't do this. It's like, I'm so weak. It's like, you're so weak. Okay, I'm gonna teach you how to walk. I'm gonna go upstairs. I'm gonna teach you how to be independent, even though you just had your chest cut open from this surgery. They're like, what do you mean? I can't do that. I can't do that. I'm like, let me show you. Let me show you this way. Or if this doesn't work, let me show you this route. Or if that doesn't work, let me show you this route, and this route. The thing I like about therapy is that as creative as your mind can be, that's how many ways you can do therapy with a patient. I say everything is therapy. There are times where I've literally just danced with patients. You're like, what do you mean dancing? Dancing's not therapy. Dancing's a lot of therapy. Because if a patient can't stand up by themselves, I have to help them stand up. I'm gonna teach them how to walk. I'm teaching them how to do side steps, step forward, step backwards. They're just doing it to music, so it's almost a distraction for them. So they actually are able to do more because they're not thinking about it. They're just enjoying their music. And I'm sitting here watching how they're stepping. I'm sitting there analyzing how much I'm holding them. I'm listening to their breathing, how they're breathing. I'm looking into their eyes. I'm looking at their face. Are they actually talking to me? Are they talking at me? Are they talking coherently? Are they talking complete gibberish? Even if they're speaking a different language, their family's in there, they're like, what are they talking about? That's the cool thing about therapy, is that there's so much you can do, even in the hospital setting. Even with your patients that are total or cis, and the family's like, oh, wait, we can't do that. Like, what can we do? I'm like, I'm here to teach you. I'm here to show you that even though Grandma Gretchen, I'm just making my name, Grandma Gretchen is sick, she has oxygen, she has an IV, she has this tube, and this tube. I'm not here to tell you what she can't do. I'm here to tell you and show you what she can do, and to give her enough encouragement to help her try to do these things. Because whenever someone comes into the hospital, no matter what they're in here for, they're afraid. The hospital is not a fun setting, for the vast majority of people. I enjoy it because I like helping people. I like to show people that they can do more than they think they can do. But patients, it's not a fun time. So I come in, I'm laughing, I'm smiling, I'm trying to joke around with them. I'm trying to treat them like a person, which we often forget about in healthcare, is that we treat patients like patients, and sometimes we treat them like numbers, which is very, very sad. So instead, I'm like, hey, my name is so and so, and I shake everyone's hand to treat them like a person. And I don't shake them like oh, you're soft. I'm like, I shake your hand like a person. It's like the only difference between me and the person in that bed are the color of the clothes we're wearing. That's the only difference. I'm a person, you're a person. You know, I get out of bed, you can, sometimes you can get out of bed, sometimes you can't. That's why I'm here to help you. But people are people. And I try to go into each patient's room to remind them that. And I try to remind them, like, hey, like in healthcare, we do a bad job of not treating patients like people. We treat patients like numbers. We treat patients like hospital gowns. We treat patients like disease. We treat patients like something we're trying to fix. We don't treat patients like people. So I try to shake everyone's hand, and I'll say, hey, this is therapy's goals. Our therapy goals are this, and this. What do you want to do? What do you want to try out? And sometimes they're like, oh, I want to try this, I want to try this, I want to try this. Or sometimes like their goals are a little bit less than ours, and I'll say, hey, this is what we'll do. We'll have my goal as our stretch goal, but we'll do what you want to do. So let's say if my goal is to get someone up and walking, and their goal is sitting on the edge of the bed, I'll say, let's try this. Play things step by step. We'll go ahead and get to the edge of the bed. If we do good with that, we'll stand up. Check our balance, see how we do. If we do good with that, we'll try to take a couple steps. But if not, if we can't do that, we at least got to the edge of the bed. How about that? And they usually say, okay, let's try it. If they say no, then I'm like, okay, no, let's just see what happens. If we're not there, then I'll get you back in bed. Because I want to respect, your decision, your autonomy. I want to respect your choices because you are a person. So I want to respect what you feel like you can do, but I also want to push you to do things that you didn't think that you could do because you were nervous, you're afraid. Because again, the hospital is a scary place. People don't go in here and get heart surgeries for just because it's a fun thing to do. No, people don't come to the hospital and lay in their beds and have to ring the bell whenever they need anything. No, that's not fun. People don't want to do that. So I'm here to help spread cheer whenever someone is in, and sometimes their lowest points. That is one of my jobs as a therapist. My job as a physical therapy assistant is to get someone up and moving as safely and as soundly, and trying to get them as independent as they possibly can. Because once you start to lose your independence, that's when a lot of depression starts, once you start losing your independence. So my goal as a physical therapy assistant is to help people get as much independence back as they possibly can, so they can live their normal lives. That's my goal. But like I said, just finishing up work not too long ago. I was all caught up on my documentation. I had to run to a patient's room last minute because different things happened. They just needed my help for a quick minute, so it wasn't that big of a deal. But yeah, just finished. I'm going to go ahead, head on home. I'm here again. I work too much. I work too much. I got too many jobs. Thankfully, I have what I call technically 4 jobs if you want to, because I work full-time as a health and wellness coach. I work part-time as a physical therapy assistant. We call it PRN. So PRN as a physical therapy assistant, full-time doctoral student, and I go to the gym. I treat the gym like a job because how much effort I put in. Because I don't just I'm going to the gym. I'm pushing everything. I'm tracking everything. I'm monitoring everything. I treat the gym like a job. I can treat it. I can treat it better, but I treat the gym like a job. But technically, I have. If you're just counting stuff I get paid for and things that are going to actually pay me, physical therapy assistant, health and wellness coach, and school. But yeah, that's it. Just want to check in with y'all for a little bit, chop it up. As I said, heading home. Your boy's tired, but I'll be back tomorrow. Later.